How to treat and cure sciatica. Sciatica is leg pain caused by a pinched nerve in the lower back. Although the pangs begin in nerve roots located on either side of the lower spine, they then course through the sciatic nerve, which runs the length of each leg from the buttock down to the foot. The most common cause is a herniated disc. When a disc develops a tear or crack and bulges into the spinal canal, it can pinch the sciatic nerve. Usually symptoms clear up within about 6 weeks, but for some people, the pain can last. Symptoms: pain that radiates from your lower, lumbar, spine to your buttock and down the back of your leg is the hallmark of sciatica. You might feel the discomfort almost anywhere along the nerve pathway, but it's especially likely to follow a path from your low back to your buttock and the back of your thigh and calf. The pain can vary widely, from a mild ache to a sharp, burning sensation or excruciating pain. Sometimes it can feel like a jolt or electric shock. It can be worse when you cough or sneeze, and prolonged sitting can aggravate symptoms. Usually only one side of your body is affected. Some people also have numbness, tingling or muscle weakness in the affected leg or foot. You might have pain in one part of your leg and numbness in another part. Causes: sciatica occurs when the sciatic nerve becomes pinched, usually by a herniated disc in your spine or by an overgrowth of bone spur, on your vertebrae. More rarely, the nerve can be compressed by a tumor or damaged by a disease such as diabetes. Risk factors. Risk factors for sciatica include age. Age-related changes in the spine, such as herniated discs and bone spurs, are the most common causes of sciatica. Obesity. By increasing the stress on your spine, excess body weight can contribute to the spinal changes that trigger sciatica. Occupation. A job that requires you to twist your back, carry heavy loads or drive a motor vehicle for long periods might play a role in sciatica. Prolonged sitting. People who sit for prolonged periods or have a sedentary lifestyle are more likely to develop sciatica than active people are. Diabetes. This condition, which affects the way your body uses blood sugar, increases your risk of nerve damage. Tests and diagnosis. Imaging tests. Many people have herniated discs or bone spurs that will show up on X-rays and other imaging tests but have no symptoms. So doctors don't typically order these tests unless your pain is severe, or it doesn't improve within a few weeks. X-ray. An X-ray of your spine may reveal an overgrowth of bone spur, that may be pressing on a nerve. MRI. This procedure uses a powerful magnet and radio waves to produce cross-sectional images of your back. An MRI produces detailed images of bone and soft tissues such as herniated discs. During the test, you lie on a table that moves into the MRI machine. CT scan. When a CT is used to image the spine, you may have a contrast dye injected into your spinal canal before the X-rays are taken, a procedure called a CT myelogram. The dye then circulates around your spinal cord and spinal nerves, which appear white on the scan. Electromyography, EMG. This test measures the electrical impulses produced by the nerves and the responses of your muscles. This test can confirm nerve compression caused by herniated discs or narrowing of your spinal canal, spinal stenosis. Treatments and drugs. Medications. The types of drugs that might be prescribed for sciatica pain include anti-inflammatories, muscle relaxants, narcotics, tricyclic antidepressants, anti-seizure medications, physical therapy. Once your acute pain improves, your doctor or a physical therapist can design a rehabilitation program to help you prevent future injuries. Steroid injections. In some cases, your doctor might recommend injection of a corticosteroid medication into the area around the involved nerve root. Surgery. This option is usually reserved for when the compressed nerve causes significant weakness, loss of bowel or bladder control, or when you have pain that progressively worsens or doesn't improve with other therapies. Home remedies. Stretching. Stretching exercises for your low back can help you feel better and might help relieve nerve root compression. Avoid jerking, bouncing or twisting during the stretch. Turmeric. Turmeric is another effective natural remedy for sciatica because of its anti-inflammatory properties. It contains a compound called curcumin that helps reduce nerve pain and inflammation. Massage. Massage therapy can relieve sciatica pain and also help the body heal itself, especially if the problem is caused by a muscle spasm.